While we conduct our business, hopefully our speaker can log in with us. So first for today, you can see on the screen there, I hope, our agenda for today. So I would accept a motion from someone to accept the agenda for today's meeting.
So motion.
A second?
I second. Whoops.
RJ was the motion and the second is?
Rita.
Rita, thank you, Rita. Anyone have any additions or changes to the agenda? Hearing none, I'd ask for a vote. All those in favor of approving today's agenda, please say aye.
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 Any opposition?
Aye.
Thank you. The agenda then moves forward. Next, we did send around to our senators the minutes from the previous general membership meeting. So I'd accept a motion to approve the previous minutes. Please state your name.
Jenna Lenz, I'll motion for that.
Thank you, Jenna. A second?
Lynn Eminger, second.
Any changes to the previous minutes? Hearing none, I call a vote. All those in favor of accepting the previous minutes, please say aye.
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 Any opposition? Thank you. So we do accept the previous minutes as well. At this time, I'm asking if we do have Dr. Burstein on the line. Dr. Burstein, are you with us?
She's connecting.
Great. So we'll give her a few seconds when she connects. And then once Dr. Burstein connects, we're going to mute everybody just because of the sheer volume of the people on this call. So we are going to mute you. We'll ask Dr. Burstein and myself to reconnect. I'll do that right now.
Oh, well, hi, I'm on.
Dr. Burstein, thank you. Can you hear me?
Yeah, I'm just trying
Excellent.
to get this.
No problem. What I'll do is while I do an introduction of you, we have quite a large group assembled to view you. I'm going to stop sharing my screen and we're going to make you the co-owner of the meeting here and allow you to share your screen if that's what you'd like to do.
Yes, that would be great. Thank you.
Okay,
just,
so Jessica, please make Dr. Burstein a co-owner. I'm going to stop sharing. And then I'll do a brief little introduction. So Dr. Burstein, I'm Tim Drzenkowski. Thank you for joining us today. I'm the chair of the Professional Staff Senate. What we're going to do is mute everybody. We did ask for questions ahead of time from the various leadership and groups across campus. So we do have some questions we pre-supplied to Dr. Burstein. If anyone has a burning question today, please do not unmute yourself and ask the question. It's just that it's an invitation for chaos. Rather, send things to the chat room. And we'll triage the questions in the chat room. And if time permits, we'll ask them of the doctor at the end of the meeting. All right, so members of the Professional Staff Senate at the University of Buffalo. Today we have a guest speaker, Dr. Gale Burstein. No N, Dr. Gale Burstein.
Right.
So
Hold
please,
on, I'm just going to close my door. Sorry.
Be aware of that. She is a clinical professor of pediatrics at the University of Buffalo, a research professor at the University of Buffalo School of Public Health and Health Professions, commissioner of the Erie County Department of Health, physician faculty for the New York City STD HIV Prevention Training Center, the attending physician at Kaleida Health High School Clinics, the attending physician at the General Pediatrics of UBMD Pediatrics at the Oshai Children's Hospital. And as I looked her up, there are pages and pages more of positions held, honors and awards, education and degrees. We are in very good hands today, and I offer to you Dr. Gale Burstein, the Erie County Director of Health. Thank you, Dr. Burstein.
Thank you, and thank you for inviting me to join you. And you know, when you say that, it just brings to mind. My husband always tells me I look good on so good on paper. I'm like, thanks. You look good on paper. So anyway, so thank you for inviting me to speak to you all. And I'm very honored as UB faculty to be able to speak to you. And I really appreciate your interest in what we're doing in COVID-19, because it's really important that the community is aware of the good work that we're doing, and also of what the strong recommendations are for our preventive measures to bring our numbers down. So what I'm going to do now is share my my screen. And I'm gonna put the in slideshow. Okay, can you see the slide now?
Yes.
Okay, great. So, so I'm going to give you all a COVID-19 update. And as I said, so first I'm gonna update you with our current numbers from our epidemiology office. So, so we all know where we are. So far in Erie County, we've documented 63,558 unique COVID-19 cases through February 23rd. Our 7-day positivity rate is 4%. And unfortunately, there's been so far as of February 18th, 1,635 COVID-related deaths that's been reported to the health department. And just in terms of hospitalizations, in all the hospitals in Western New York, there are, as of February 23rd, there were 224 COVID-19 patients, and 48 of those were in the ICU. In our Erie County hospitals, there were 190 patients admitted for COVID-19. Of those, 43 within the intensive care unit, 32 were on some type of airway assistance, 3 died in the past 24 hours, and 43%, so almost 50% of the patients were actually under the age of 65. And I know that we all know that our seniors are at highest risk of severe illness and really death. However, people who are below the age of 65, who are not officially seniors, also get very ill with COVID-19 and end up in the hospital. So this table is looking at the diagnostic testing done and the results and the proportion of positive test results in Erie County for the past 6 weeks. So the bottom row is our data for the last week ending on February 20th. So last week there were almost 41,000 tests, COVID-19 tests done among Erie County residents. And of those, there were 1,746 tests that were positive, and we did contact tracing on every single one of those to make that 4.3% of the tests were positive. So you can see, looking back 6 weeks time when the week ending on January 16th, we saw much higher numbers, almost twice the numbers. There was also much more testing done, and the proportion of positive tests was also much higher. So we've been coming down steadily in terms of number of cases and proportion of positive tests. We're not sure why there seem to be less people interested in testing, although there's still quite a bit of testing done in Erie County. Like, testing isn't as hot as it was in the winter when we had what we feel was a surge in cases from as a result of holiday gatherings and travel. So this is a graph looking at hospitalizations among in the Erie County hospitals for COVID-19. Since we started looking at this in about the middle of March, up until this past week. So the blue line are all the people who are hospitalized for COVID-19 in Erie County hospitals, and the red line are all the people who were admitted to the intensive care units for COVID-19 in Erie County hospitals. So you can see that if you look back in the spring, in March and in April of 2020, remember that was a very scary time. We were really worried we were going to run out of hospital beds, and we didn't know, and we were going to run out of ventilators. And remember, the governor wanted to take the ventilators from Erie County that were not being used and take them to New York City, and the hospitals stood up and opposed that, and we were all really scared. And then fast forward to this winter, this late fall and winter, our numbers were of people admitted for COVID-19 in the hospitals was even higher, twice as high. However, the hospitals, really worked hard to think about how to to reorganize, to make sure that they had adequate staff beds, not just beds, but well-staffed beds to be able to take care of patients with COVID-19. And they made changes, like they stopped elective surgery, so those when people wouldn't be admitted. And he just made some smart changes to the hospitals to be able to accommodate more people who admitted for COVID-19. You can see we never ran out of hospital beds, so the hospitals really came through and were able to problem solve. So this slide is looking at kind of a summary of our overall response, how we're responding at the Erie County Health Department to COVID-19. So I'm just going to quickly walk you through this. So we have our Office of Epidemiology, which is kind of where it all starts, and they're getting all the reports of COVID-19 through our surveillance data, and doing analysis on that, seeing what risk, who are the risk groups, with the ages, the genders, the race, ethnicities, the neighborhoods, the zip codes where we're finding COVID-19, to see where our hotspots. Also our contact tracing, which is really case investigation, is finding out who were the close contacts of these new cases, and putting them in quarantine, and making sure that the new cases understand that they have to be in isolation for 10 days. And we also have a special team of in our epidemiology office that are specifically devoted to help to the cases in the schools, and helping the schools figure out how to make sure that all cases are stay out of school, and all close contacts stay out of school, and work with us so we know who are the close contacts in the classrooms, not just in K through 12, but also in the colleges. And making sure that give guidance to the schools about mitigation strategies that and how to comply with the state's guidelines, which is really the states writes the policies for the schools with the state education department and the state health department, and we help them figure out how to implement some of those. Also, we have one of 3 public health labs in the state, and we have a biosafety lab, a level 3. So, and we're in the CDC's laboratory response network. So we're able to get cool tests like the COVID-19 test directly from CDC. The other 2 public health labs in New York State, the New York State Health Department has a public health lab in Albany and Wadsworth, and then New York City has a public health laboratory, but that's it. So it's just the 3 of us. So we do PCR testing for COVID-19, and we also do antibody testing for COVID-19 and through our public health lab. We also have our environmental health, and they are our enforcement arm. So, they routinely, before COVID, like forever, we have public health sanitarians that inspect restaurants and, hopefully prevent any type of foodborne outbreaks. And they've been tasked to make sure that restaurants and bars are complying with the governor's emergency orders around COVID-19. And then also their repertoire of the facilities they have to enforce has had to expand during COVID-19 because the governor wrote guidelines for reopening for other facilities like gyms, fitness centers, amusement parks, theaters, and so our environmental health are also enforcing those. But it's not, our goal is not to close anything down. Our goal is to make sure that these businesses are able to open up safely and comply with the guidelines that are published by New York State, so that everybody stays safe and while they're able to hopefully have fun or stay active and be healthy. All this costs money, so our accounting office is a key partner in our response. We also have health communication is very important. We feel that it's important that people understand what the situation is with our numbers and what we're recommending to protect themselves, and what the governor has issued in terms of emergency orders. So we have our call center 858-2929 where people can call to get information, and they can also schedule a COVID-19 test. And then also we have a lot of great information on our COVID-19 website that I'll show you just now. We also have our public health emergency preparedness, which we are always doing drills to prepare for these type of pandemics. So we are ready. We're actually doing a number of things with our public health preparedness team to respond to the pandemic. First of all, they're helping with the diagnostic testing. Our public health preparedness team is doing the rapid testing that is offered by Erie County Health Departments, and they're collecting the swabs, the specimens for the PCR testing for our public health lab. They're also collecting specimens when we're doing antibody testing in our public health labs. And most importantly, now they are running our vaccine points of dispensing or our vaccine clinics or pods. So, and that is it's much more complicated than meets the eye. And so they're doing a great job. We're getting lots of shots in arms. And then we also have to coordinate with other county departments and also with the New York State Department of Health, because we can't do it alone, and we can't work in a bubble, in a vacuum. So just talking about one of our strongest tools to prevent transmission within the community is case investigation and contact tracing. And this is how we break the chain of transmission of communicable diseases for all diseases. The most commonly reported diseases in New York State and in the United States are sexually transmitted infections like chlamydia and gonorrhea. So we know how to do this, and now we're doing this for COVID-19. So what we do is we call every single individual in Erie County that has a COVID-19 positive test. We notify, making sure they know that their test result is positive, regardless of who tested them, and then making sure that they understand that they're in isolation, and we place them in isolation, explain to them how to do that, and then we conduct a case investigation, and we find out who their close contacts were. So anybody that they were within 6 feet for 10 minutes or more during the time that they've been contagious were defined as close contacts. And we find out who they were and put those individuals in quarantine for 10 days. And also making sure that they understand that they should get tested to know their status, like 5 to 7 days after their last contact, because if they are infected, you have to give the virus a little bit of time to get a high enough viral load so they can be detected by a test. So I think that a lot of people are confused because they think that from contact tracing, we're able to determine the source of infection from every case. But actually, it's impossible to do that because you'd have to do DNA sequencing, and we don't determine what the source of infection is. Although many people volunteer what they think their source of infection is. I mean, sometimes it's very obvious if they're living with somebody in their household who has COVID-19, that's probably where they got infected. Or if they were at a gathering where somebody had COVID-19, we saw that a lot during the holidays. That's where they got infected. Or on a sports team where there's somebody has COVID-19, that's probably where they got infected. But we can't determine exactly where people get infected. Those are kind of the most common places where people get infected. But that's our job with contact tracing, is not to determine where people get infected. This is to prevent other people from getting infected from that case. So putting that person who's infected in isolation so they don't come in contact with anybody else and infect them during their infectious period, and then put their close contacts in quarantine. So because they are at very high risk of being infected themselves, even though they might be asymptomatic. So we want to make sure that during the incubation period, they are away from everybody else in the community and don't infect anybody else. And again, the close contact definition is anybody who was within 6 feet of a person with COVID-19 for 10 minutes or more during their infectious period. So many people also have questions. Well, when, should I get a COVID-19 test? When should I get a test? So if you have symptoms of COVID-19, which is like anything actually that would make you not feel well, which is a new symptom. Some people have like chronic problems that they may have like pain all the time, like headaches, like migraines all the time, or something all the time. But this is something new. Although we see a lot of people who have said, "Oh, I have sinus infections all the time. This is just my sinus, and then they get a test, and then it turns out it is COVID-19. So, people who develop an onset of symptoms for, any symptoms for any reason should really think about having a COVID-19 test, because we have a lot of availability, and it's really important to know your status, because that's how we keep our numbers down. So if people were exposed to COVID-19, as I said, they should get a test so they should know their status. And again, they should wait at least 5 to 7 days after the last exposure to make sure that if they are infected from that contact, that their viral load is high enough that the test would be able to identify that virus. And then, if your doctor or healthcare provider recommends you should get a test, then you should, for any reason, you should probably get a test. So we have, we offer testing in the Erie County Health Department through our public health lab, and our public health preparedness folks do the rapid testing. And this is all free. So you can call 716-858-2929 to schedule an appointment. Also, if, you want to get something faster than we can do, or it's like the middle of the night and you really want to test, you can go to our Erie County website at erie.gov/COVID test sites. And we have an interactive map that lists all the sites that are approved by New York State to do COVID-19 testing. And if you just click on the dot where the test site is, a little pop-up box will appear and give more specific information about the hours of operation, the type of test you do, if you need to pay for it or out of pocket or insurance, or it's free. And then I think the hot topic now are vaccines. So currently in the United States, there are 2 vaccines available on the market. There is the Pfizer vaccine made by Pfizer, and vaccine for COVID-19 made by Moderna. Both of those are 2-dose regimens. The FDA has authorized their use because we have a public health emergency. And the Pfizer is authorized for use of people who are 16 and older, and the Moderna is authorized for use that are people who are 18 and older. So, this is a moving target. We know that Johnson & Johnson is going to applying to the FDA now for emergency use authorization, and so hopefully we'll have another vaccine on the market. And the advantage of that is that that is just 1 dose, so it'll end the cold chain requirements aren't as difficult. So that'll be an easier vaccine to dispense. And so we're excited about that. However, and then also we know that the companies Pfizer and Moderna are doing studies now to ensure that children also will be able to get vaccinated. And I think the studies are going down to as young as 6 years of age. So we know from the studies, the good trials that were conducted, all these trials were good phase 3 trials. They had between 30 and 60,000 people enrolled, which is what is the standard for any vaccine trial. So these were good trials. We know that they are safe, and we know that they are effective for preventing disease. So just in terms of getting access to the vaccine, so I hope that I hope many of you have been vaccinated, and if you haven't yet, I hope many of you are getting excited to getting vaccinated soon. I guess it's good news and bad news that our demand does not meet the supply. So, supply does not meet the demand. So it's good that there's a lot of demand. We're all very frustrated that the supply isn't better. However, the federal government controls the vaccine supply to New York State, and then New York State gives all the counties their supply of vaccines. So we are dependent on New York State for our supply of vaccines. The New York State is giving vaccines to all different types of providers to vaccinate. So they're giving them to pharmacies, to healthcare providers, to hospitals, to local health departments. And then also the states have a vaccine hut, at UB on the South Campus at Harriman Hall. And then also the federal government is also setting up some vaccine sites, and they are actually working with New York State to open up a site next week at the Delvin Grider Community Center. So that'll be another opportunity for people to get vaccinated. So the question is, who, not everybody right now is eligible to get vaccinated because our supply is so short. So what we're trying to do is making sure that the people who are most at risk of getting exposed to COVID-19 and most at risk of getting very, very sick if they did get infected with COVID-19 have the first shots. So the New York State has developed these criteria and these for people who are eligible for vaccine. So appointments are required for everybody to get a vaccine, wherever you get vaccinated, whether it be from the health department or from a pharmacy or from the state site, you need to have an appointment. And then if your criteria is that makes you eligible for vaccine is your job, your place of employment, you have to bring some type of proof that you are eligible from your place of employment. If it's age, you have to just bring some type of documentation of your age. And then for the comorbidities, I think we're just asking for, and the state is asking for some type of self-attestation. We're not asking you to bring a doctor's note, although you can bring a doctor's note. However, we're just asking people to be honest and just self-attest, that they are eligible because they have one of the chronic conditions that are on the New York State's list, making them eligible to get a vaccine. So what we're asking people also, if they are on isolation because they've been infected with COVID-19 recently, or if they're in quarantine because they've been exposed, we're asking that they don't show up at a vaccine clinic because we don't want people that are giving vaccines to get infected with COVID-19. So they just have to wait till after their isolation or quarantine is over. Also, people who get infected themselves, a natural COVID-19 infection, we know from the literature that there is a good protection for at least 90 days. There was just actually something published in the New England Journal, I think last week or the week before, that shows looking at healthcare workers in the UK and showing that if they had antibodies to COVID-19 from a previous infection, because this was before vaccines, that they didn't get reinfected for at least 6 months. So we know that people who have COVID-19 in the past 90 days don't need a vaccine to get infected, be protected from another infection because they have their own natural infection. So we're just asking people to be honest and step aside in line because they're already protected. They don't need the vaccine right now, and let people that don't have any natural immunity to COVID-19 or are at risk of getting infected to get the vaccine. And we anticipate, in the next couple months, there'll be more vaccine supply in the general public, and more people will be able to get vaccinated. However, that's not now. It's probably going to be, we're probably not going to be able to open up vaccination to the general public that is, doesn't have certain jobs and isn't over 65 and doesn't have like certain chronic, condition diagnoses until probably, the summer. So it'll still, take a while, but we are getting, the Biden administration has assured us that we are going to get more vaccine supply into the public. And that will mean in Erie County, if we get vaccine supply, those shots go directly into people's arms. So we turn it around in less than a week, and we don't waste vaccine. So our biggest challenges now, besides the supply, are vaccine hesitancy. People are concerned about, about the safetiness and the safety and effectiveness of the vaccine. And that's especially of, people of color and immigrant populations, because the government hasn't treated them very well in terms of the past in terms of healthcare, and there has and so healthcare and the government have to build up trust again with those communities to be able to assure those people in those communities that this vaccine that we're offering is safe and effective. And so, we're working with leaders in those communities to really stand up and say, yes, this is safe, this is effective, get vaccinated, help get this. This is our only ticket out of the pandemic, is getting vaccinated. We're also going to run into challenges getting people vaccinated who are homebound or disabled and can't get to vaccine clinics. So that is a challenge. So we are, going to try to make it as easy as possible for people who are eligible to get vaccinated to make an appointment. We're actually purchasing new appointment software that we're going to be able to make it easier for people to schedule appointments online. And we also are opening up a vaccine call center. So people who have difficulty with navigating the internet or don't have, good access to internet, they live in in a rural area, they'll be able to make a phone call. We also have purchased through the CARES Act, relief funding for COVID-19, using those dollars to purchase a medical fitted recreational vehicle. It actually has 2 medical bays, so 2 full exam rooms, and we're going to be able to take that out to the community to to reach underserved people or people can't get out and vaccinate them. So we're working with our community groups to, get good information out there because there's a lot of bad information on the internet and a lot of really bad rumors. Even my husband is a physician, and there was this rumor flying around in his office that the vaccine makes you infertile. He's like, "Are you like?" Doctors were saying that, and like, "Are you kidding?" Like, don't you read JAMA or the New England Journal? Like, where are you getting that information? Like, oh, from a friend, or I saw it on the internet. Like, please. So we really have to make sure that we listen to the scientists and the science, not some rumor website. As I mentioned earlier, we anticipate that the vaccine supply in the United States will increase by the summer. So Pfizer and Moderna have pledged to produce 200 million vaccines to the United States by the end of July 2021. And so that's just a few months away. And then Johnson & Johnson, hopefully they'll get FDA authorized for emergency use, and that'll be another vaccine in the marketplace. So we do anticipate that the vaccine supply will increase. Until then, we have to continue with the preventive measures that we know that work. So those are staying home when you're sick, wearing a mask when you're around other people outside your household, maintain good social distance when you're around people outside your household, 6 feet or more. You want to minimize any type of indoor gatherings. We're seeing transmission and, just people going other people's houses to watch a football game or a hockey game. We want to, hopefully, people are going to wash their hands and making sure there's good disinfection at the workplace or wherever, or the school. And then, when it is your turn to get vaccinated, get that shot. The vaccination is our ticket out of this pandemic. So, the New York Times published a really great graphic that I'm showing you a couple months ago, likening all the preventive measures that we have is like a slice of Swiss cheese. So each preventive measure by itself is not going to fully protect everybody from COVID-19. So it's not just wearing a mask is going to fully protect you, or socially distancing is not going to fully protect you. We have to do all these things together to be able to prevent transmission. So so it's like each slice of Swiss cheese has holes in it, and so the virus can get through those holes. But if you stack up a whole bunch of slices of Swiss cheese, all the holes will eventually get covered up, and so there won't be any virus be able to get to the other side of the sandwich. So we have to operate under that premise. So, and then once you are vaccinated, we still have to continue practicing these preventive measures that are very important, because, we're really not going to be out of the woods until we're able to get enough people vaccinated in our community to get herd immunity, that there are enough people that are not able to, are protected against infection, that a virus will have difficulty getting hold in the community. And also the studies that were done to get FDA authorization for emergency use, the endpoints were illness or disease from COVID-19 and severe illness and death. And the studies didn't look at prevention of infection. And so still, people who were immunized, there could be a chance that they could be infected and just feeling really well. So we hope that's not the case. We think that's not the case, but we don't have data to really show that. So we still have to practice our preventive measures. And then also with these mutations and various variant strains, encroaching into our community, we're not sure as what the effectiveness of every single vaccine on the marketplace will be. when we start to see these variant strains. So if you develop COVID-19 symptoms, it could be COVID-19, even if you've been vaccinated. So you really should get a test for COVID-19 if you develop COVID-19 symptoms, even after you've had a vaccine. And then also you want to do like everybody else when they have symptoms, stay home when you're sick and isolate from other people, because even if you don't have COVID-19, you have something else that I don't really want. So this is a slide looking at resources that we have online on our Erie County Health Department website. We have general COVID-19 website, and our hotline, as I mentioned, 858-2929. We also have, as I mentioned earlier, a map on our website that lists our surveillance data. So it lists the number of cases by zip code or by municipality. So you'll be able to see like kind of where you stand in your neighborhood or your community. And as I mentioned earlier, we also have a website with an interactive map to see where the testing is available for COVID-19 in Erie County. And then also we have information about COVID-19 vaccine on our website too. So as I mentioned earlier, health communication has always been a priority for the health department while I've been health commissioner. I think it's really important that people stay up to date and informed, not only nationally what's going on, but and also what's going on here locally. So because public health is local. So the county executive and I do regular video updates that some of the news stations live stream every Tuesday at 2 p.m. It's on our county YouTube channel, and that's always live streamed. So if the stations aren't live streaming it and you want to see us live, you can tune into this our county's YouTube website. We're also posting great information on social media. We have a Twitter account, a Facebook account, Instagram account. So please like us. We like you. So please like us and help us share information. And then also we have good information on our website. And so now I'm just going to, so that's really the end of my talk, formal talk. So I wanted to get into some questions and answers that you've sent me. Is that okay?
That's great. As a matter of fact, even a few more came in. So when you're done, let me know if we have just a few more minutes to ask you just a few more questions as well. Thank you.
Okay, so I guess one question is, do you think it's advisable to operate a food service facility on the same floor and in the same building as a COVID vaccine center with no physical separation between the activities? So the thing is that in general, the people who are coming into the vaccine sites, I mean, they're not protected yet from vaccine. They're coming in to get vaccinated. So they have, so we assume that there's kind of the same level of COVID-19 prevalence among people who are in these vaccine pods or vaccine clinics as there is in the general community or in any other parts of the facility. And so, if you are going to have a vaccine site at the same place where you have, other activity in the same building, you have other activities, you have to make sure that everybody is adhering to these preventive measures, to our mitigation strategies. So you want to make sure that everybody's social distancing, wearing a mask, and that you have good flow of traffic to prevent any type of like crowding. And so there's one door for going in and one door for exiting, and making sure that the facility also has good ventilation. If it gets warmer, keeping the doors and windows open. And then also that it's there's good disinfection, it's cleaned often, and that mask wearing is enforced, especially when people aren't eating. And then you might think that you might consider making the food place just a takeout and asking people to eat somewhere else. So those are all things that you can do to enhance prevention in any type of facility, whether it has food takeout or it has a vaccine pod in it or both. So did that answer that question?
It did. Thank you very much. Yes.
Sure. And so the next question is, we've not heard much about contact tracing. How's that being done in Erie County? So I think I answered that, right?
You did cover that for us. Thank you. Yes.
Okay, great. So is it worthwhile to take a COVID test before traveling or visiting with vulnerable relatives after receiving the vaccine. So, as I mentioned, the data we have, what we believe that people who've been, fully immunized and protected more than 2 weeks after their last dose, but within 90 days, we know that they're protected for themselves against illness from COVID-19. However, we don't have data, although that they will not get infected themselves. Although we believe it's biologically plausible, we believe they're probably not going to get infected. However, with all these variant strains circulating, we may not know for sure. So I think it's good preventive measure anytime you travel, or especially if you're going to be visiting a loved one, whether you travel outside the area or not, that you get a COVID-19 test. And as I said, there's a lot of tests available. There's not a problem getting a test, and and especially if you're going to be, you want to get this because you're going to be coming in contact with other people, I'd recommend getting a PCR test rather than a rapid test. The PCR test is much more sensitive. The rapid test might miss an infection among asymptomatic people. So, the test will detect COVID-19 virus, especially the PCR test. It's a very sensitive test, even if people don't have symptoms from COVID-19, whether they've been vaccinated or not. So did that answer that question?
That did. Thank you. Yes.
Okay. I've been hearing people are getting sick for about 24 hours after a second vaccine. Why does that happen? And also why after the second and not the first dose? So why people may develop some kind of flu-like symptoms, like they may feel hot or even get a fever or feel like achy and maybe get a headache. And after the vaccine, it's because so remember, the way the vaccine works is that it presents a protein that looks like the spike protein of the COVID-19, and your body's like, hey, there's something here that shouldn't be here. Let's make antibodies and make sure that we don't get infected. So your body's acting like you might be infected. So when part of your immune response, a side effect of that, of like revving up your immune response is, you might have some fevers, you might have like some little aches, and you might have some aches and pains for a day. So that just means that the vaccine's working. Actually, if you talk to an infectious disease specialist, that they might say that they would be very upset if they didn't feel sick after getting their vaccine, because they'd be worried like, oh, is it not working? And so that's good that if you feel a little bit sick after your vaccine, the illness could be from, your illness feelings could be from the vaccine. It could be from something else. So you want to make sure that, you get isolated, you isolate that day when you feel sick after the vaccine. And then if it continues for more than a couple of days, that you get an evaluation by a healthcare provider, which should include a COVID-19 test. And then the clinical trials showed that side effects from the vaccine were more likely to occur with the Moderna product than the Pfizer product, and they were more likely to occur with the second dose compared to the first dose. So I'm not sure exactly why, but that's what they found in the clinical trials, and it seems to be borne out in the community. However, just in terms of looking at safety issues, the CDC has multiple different surveillance systems operating now to look at safety issue, like post-marketing safety issues with the vaccine. So there's the CDC also has a website that you can enroll and to report to CDC if you're feeling sick or if you had any adverse effects after you've been vaccinated, and that information is at all the vaccine sites. So you'll be able to, they all have QR codes, so you'll be able to scan that and or websites, and you'll be able to enroll in that, and they'll just contact you periodically after your vaccine, and with an email, and ask you if you're having any symptoms. So so that the story's not done yet. We are still looking at safety and efficacy issues. So I hope did that answer that question?
It did. It did indeed. Yes.
Okay.
I do have one more for you once you get through these also. So thank you.
Okay. I have another meeting at 4. So that's when I turn into a pumpkin.
I'd like to interject here with one that's sort of a burning question. Since this group represents the professional staff at the University at Buffalo, in the 1A or 1B category, it is for student-facing faculty. They're eligible for the shot for the first vaccine. However, we have hundreds, if not thousands, of people here at the university that are professional staff that still interact with students face-to-face on a daily basis that are not eligible if they don't meet the age requirement or what have you. So we're asking how we can get our professional staff included. It would just be really just adding faculty and staff of the universities or colleges to be eligible for that.
Right. Well, that's a great question. The criteria for vaccine eligibility in New York State is seems to be a moving target. So what I recommend, and the state sets the criteria of who is eligible for vaccine. So I strongly recommend that if people they want to get vaccinated and they're concerned that they may not be eligible, to confirm that with actual data. So they can go to the New York State's Am I Eligible website, and they can go and it asks you a set of questions, and that will determine if you are eligible for vaccine or not. So keep checking if you're eligible, because it's not only eligibility from your job, there's also eligibility for certain chronic health conditions and age. So I recommend that people go to the Am I Eligible website and determine the eligibility themselves.
All right, thank you. The other question that we have, you mentioned earlier that the vaccination, or I should say that you would be 90 days after having the illness, you should still have some immunity built up. So maybe you could delay getting that first test a little bit. The next question was, how long do you feel?
I'm sorry. Well, if you've been infected, we believe you have good, strong immune protection for 90 days after your infection. However, not all viruses read the textbooks, and they don't always follow the rules. So, I mean, there are cases where people could have a breakthrough infection. So, if you should still talk to your healthcare provider if you have symptoms to decide what could be causing the symptoms and what would be the right thing to do.
As far as getting the shot, I guess the question is,
no,
how
you
long?
should still. Oh, sorry. Yeah,
Oh,
in
it's
terms of getting the shot, we're asking people that if people have been infected in the past 90 days, because they do have good protection against COVID-19, they just delay that getting their shot until after 90 days.
Right. Now, what about positive test results, though? If you're tested for COVID, would you be showing positive after either, how many days after having been sick with COVID, or maybe how many days after having the vaccine might you test positive for COVID if you had a test done?
So, well, first of all, if the diagnostic tests that we have are not testing for antibody. So if you were vaccinated and you're not infected with COVID, you would not have a positive diagnostic test. Hopefully you have a positive antibody test, but an antibody test doesn't tell you if you're infected with COVID-19. So we know that people can remain COVID-19 positive for up to 90 days after they've been infected, even though they're not contagious. So we know from good data that the contagious period is about 10 days after a person's been infected. However, that remnants of the virus, like the RNA, can hang out in your nose, or where most of the specimens are collected, or sometimes in the in the back of your throat for up to 90 days. But that's not viable virus. It could be fragments of virus and fragments of RNA. However, that can still be detected from the test. And so you could be persistently positive for a couple months after your infection, even though you are not contagious or actively infected. Does that answer your question?
That does help. Yes. And then I'll leave you with one last one, because I know that you have to go. UB is looking, or at least discussing, opening up more normally in the fall. If we are able to mandate that our students have to be vaccinated before they come back, what of the staff? If there's staff that are not, or faculty that are not vaccinated, should they continue to work remotely? Or if they've had the opportunity to be vaccinated and haven't done so, would they then be eligible to come back on campus in the fall into the community?
Well, the mandating vaccination for school entrance, in-person entrance into school for the COVID-19 vaccine, because it's not FDA approved, it's only FDA authorized for emergency use, is a legal question. And I think so that's being debated now, and I've also heard that there may be legislation that may be enacted that may permit the COVID-19 vaccine to be mandated for certain to be able to go to school or for certain activities, even though it's not FDA approved yet. However, I know that Pfizer and Moderna have submitted are planning to submit of their BLAs, their applications to get FDA approved. So once a vaccine is FDA approved, then you can through legislation mandate vaccine for school entry, just like we do for other childhood vaccines to prevent against other vaccine preventable diseases. So I think we have to wait, first of all, if the schools, especially a state school, which is run by a government, would be able to mandate the vaccine for students or faculty. And I know that you have a really smart group that is trying to answer all those questions, because I participate on a call with them every Wednesday morning. This is not a static situation. It's a moving target. So I think we'll see what happens when we get, this summer, when, the vaccine situation may be completely different.
Great. Well, thank you. Well, I know you have other business to attend to, as do we. So thank you for your time. I will reach out to your staff to see if we can share the slideshow or even this presentation. We've been recording this, but if we have your permission, if we can just share the highlights from today as well on our website, we'd appreciate that.
Yeah, sure. I'd be happy, and I hope people feel more empowered with good information to do the right thing to get us out of this pandemic.
I wish we had more time with you, but I know you have to go. So thank you very much, Dr. Burstein. Appreciate it.
All right. Thanks.
Take care. Unshare. All right. I'm going to share my screen, and we're going to continue on with the meeting here. Jessica, if you could give me permission to share my screen.
You should be able to do it.
Yep, I'm pulling it up right now. Great. Can you see my screen now, the slide?
Yes.
Excellent. All right, so we'll continue on now with our meeting. The chair's report. I know that we're pressed for time and we have some business to attend to, so I'll try and keep this brief. The biggest news since we last met was the announcement from Provost Weber and President Tripathi that, if possible, we're going to try and get back to the most normal fall semester 2021 as possible. That's an optimistic announcement. They've admitted that as much. It's optimistic now for planning and budgeting purposes, but the science will still lead that discussion when we get closer to that point. So there's still going to be meetings in groups, and share with your senators and your executive committee members, and they'll share with the officers all of your concerns as far as any reopening plans for the fall semester. I know right now there's hot and heavy discussions about what commencement can and can't be and things like that. But the announcement is that we're going to try and plan for a more normal fall if possible. Since we last met, the Office of the Professional Staff Senate has been very busy. Obviously, I attended the Faculty Senate plenary, and last month, RJ Multari, our professional representative on the SUNY-wide Senate, shared some of the informative slides from that group. Also, at our last general membership meeting, we heard from Deanne Keller, the Associate Athletic Director, and from Vice President for Diversity, Despina Strategakis. My take from both of those administrators is that UB, and in turn the PSS, is now in the do-it stage of our work on inclusion and diversity. So we're going to later on today contemplate our Drive to 25 resolution. But that resolution is filled with action items. And I challenge each of you as members of the PSS to work with PSS committees this year to make this the year of action across the PSS and across our campus. We've done a lot of talking about inclusion and diversity, and I really want to see some concrete things this year. So I challenge you all to let's make that happen. Days after the SUNY plenary, I was invited to attend President Tripathi's senior leadership retreat on behalf of the PSS membership. The morning was dedicated to a guest speaker from, I believe it was Vanderbilt, who was looking at how UB is positioning ourselves to enact items that will increase our efforts and our value to others when it comes to inclusion and diversity. That will allow UB to attract students and faculty of more diverse backgrounds, which, you guessed it, also moves up our profile in the top 25 rankings and matters like that. So it's all very interconnected and our top priority of our UB administration at this time. As well, UB Advancement has announced a major donor gift with a matching contribution opportunity attached to it. It'll be a sort of competition to submit bold ideas that, if accepted, will give units across campus the ability to enact bold initiatives centered around inclusion and diversity, with an added effort towards any top 25 aspirations. There's $25 million in play, along with some form of match from the UB Foundation for these programs and ideas that win approval. So you'll be hearing more about that in the days ahead. With all those numbers and all those 25s, it reminds me that the PSS Communications Committee is hard at work on our 50th anniversary logo. This July will be the 50th anniversary of the PSS at UB. So that'll be fun, with perhaps a signature box logo for everyone to use in their emails. We'll look into maybe some t-shirts or lapel pins to raffle off for everybody. But we can have some fun with the numbers of 50 and 25 this year. And I ask you all to show your pride and affiliation with the Professional Staff Senate when that logo is made available to you. In a recent Faculty Senate meeting, I heard from UB VP for Technologies, Bruce Bible. Bruce mentioned that UB is beefing up their cybersecurity. So you will see changes and upgrades coming to Zoom almost on a nightly basis. There's going to be a need for a meeting password, and or guests must sign in through UB verifications like the SSO account. They actually have a list of meetings in our IT departments of meetings that were hijacked during the last year. Some were mostly profanity laden, people coming in and just swearing. There was one, unfortunately, nude flasher in a meeting. And then there was some that were hijacked with very sadly, some racist remarks. So now there's going to be a kill switch for all faculty and staff that are hosting a Zoom meeting, that they can mute and stop video immediately if someone interrupts their class or their meeting. So look for some information on that as well. I was called several Saturdays ago, about 3 weeks ago, on a Saturday evening, and asked to attend the next day on a Sunday, the SUNY Chancellor's visit to the University of Buffalo. It wound up being pretty much a press conference to announce the conversion of a UB lab to a rapid testing diagnostic center. Before our tests went only to SUNY Upstate Medical or to a lab in Syracuse. So UB at that point expected the lab to be converted within about 4 weeks, and I believe it's operational now or very close to it. We dedicated the lab space, but a private entity came in and retrofitted the lab to conduct the conversion of the tests and give test results for COVID testing. The Chancellor also discussed how everyone must be tested weekly this spring, even guests to campus. So there was an announcement that went around. If you have someone working in your office, the printer repair person, their entity, their company has to provide proof that that person was tested before coming to campus. So they've really clamped down on that. In the past, the Chancellor said people feared that SUNY and the students were going to be the problem making the community sick. Now he almost feels it's the opposite. The campuses are very safe and testing, and we're fearful for what the community might bring onto campus. So it's kind of a double-edged sword there from him. I did unfortunately hear the last round of COVID testing at UB in the past week had close to 50 UB students testing positive. Also, just last week, the SUNY Chancellor updated the positive test percentages that would force a campus to go fully remote for 2 weeks. So UB is underneath that new threshold, but still cases are prevalent on campus. This is a very strong reminder for each one of us not to give into COVID fatigue and to keep masking up and staying socially distant from others as much as possible. Again, I mentioned UB announced a return to a somewhat more normal in the fall. The chancellor mentioned at his press conference that he would love to see that, but he's also taking a wait and see approach and see what the numbers and the science says. The press then asked a few questions of the chancellor. He mentioned that all SUNY facilities he's offered to the governor that in the drop of a hat, they can become testing or vaccination centers to help all residents of New York State. So he's at the ready to do that. After his talk was over with the press, the chancellor actually made a beeline right to me. He must have recognized me with my bald head and my UUP mask on, but he knew I was there on behalf of the Professional Staff Senate. He actually chatted with me for a few minutes. It was great. He knows we have staff that have student contact daily. And he said that every single day he has told the governor that when he expands the 1B vaccination grouping, he needs to include SUNY professionals and other campus staff. He knows, he understands, and he's making the governor aware of that every single day. It's a supply issue right now as the supply of vaccine trickles down to the county level. And of course, we learned even more about that today from our guest presenter, Dr. Burstein. Next, I want to offer a sincere thank you to Heather Hagenbush. Heather was the past chair of the Inclusion and Diversity Committee. She's going to stay on the committee, but she has notified me she is stepping down from the chair position that she has held for the past few years. Again, thank you, Heather. Some random comments. I am also keeping the president and the provost. I keep asking them whenever I have a chance to, if they have the opportunity, notify the governor or the Erie County Health Department that they also would like to see staff and others facing faculty included in the vaccination 1B group if they have a say in such matters. The plan of the PSS officers and the executive committee is later today, if we pass our Drive to 25 resolution, in it is some language about working remotely. I'd like to continue conversations with Provost Weber, looking to where we can offer remote work for our staff when feasible, when possible. There was a survey that went out to SUNY students, and they mentioned that in some instances, they enjoy the ability to remotely speak to a financial aid counselor, an academic counselor, academic advisor, things like that. So even if they're on campus, they like not having to drive over to another building, another campus, but to Zoom in. If there's an opportunity and it makes sense and it helps the students as well, we're going to explore work from home opportunities for our professional staff post-COVID, where it makes sense also. I will reach out to the president and the VP, Laura Hubbard, and also the VP for HR, Mark Caldron, because there is some concern that a lot of members and faculty and staff are contemplating maybe retirement in the next few months or years. And they would like to see a beefed up HR position or two that people can go for individual retirement, pre-retirement counseling before they make their decisions. Right now, that's not fully offered, and we would like to see that beefed up if at all possible. So we'll continue those conversations as well. In the past, we mentioned there was a tree drone inventory project that is alive and well. One of the faculty members that we were working with on that did receive a national grant for the study of trees with a sort of a heat sensing laser or a device on drones. So we're going to continue to work with them to beautify our campus and have a tree inventory on campus. That's still very much alive. And then lastly, budget. Thank you all for all the phone calls you've made. I know through your various bargaining units, you've been asked to make phone calls to federal legislators, now to state legislators. But it looks like there may be better news on the budget front than we initially anticipated. We were looking at almost 20% budget cuts across the board here at UB and at SUNY. Now we're hearing worst case scenario might be about a 5% cut. Again, we have to stay vigilant until we push that across the finish line, but it does look like there's better news out there as far as the budget goes. And also I'm hearing for those that have negotiated raises through their bargaining units, they were talking about deferring those raises for another year till 22, 23. Now we're hearing that if the funding comes through from the federal government and trickles to the campuses, we might be able to see those raises sooner than later.
Hey, Tim.
Yes, sir.
Rita Hamilton just put into the chat that there are 2 personnel associate positions for HR benefits being posted right now.
Fantastic. So that is working. So thank you, everybody who's involved with that. And yes, share the news. That would be great. TAP and Excelsior are still funded for next year, but this TAP gap still does remain. We will increase, it will only increase the TAP gap. UB is in good fiscal footing right now, especially since we're preparing for that 20% cut, but it's only going to be about 5% across the board. There is also talk on the table of offering the 4 university centers, SUNY schools that offer doctoral level degrees, to offer differential tuition to their students. UB is thrilled at that. Differential tuition would be by academic major. UB is thrilled about that and will possibly look to raise the costs in several programs across campus. That might enhance a student profile, but we will also look or sort of ask that the similar scholarship and other aid goes up as well to cover that increased tuition if it does become a reality.
Tim, it's RJ.
Yes, sir.
If I could jump in, I don't mean to contradict you, but I want to clarify that a little bit regarding to the proposed differential tuition. It would be only for the doctoral granting campuses. It would be for the entire campus, undergraduate, graduate, professional school divisions. It could not be more than 1.5% higher than whatever the established rate is for the rest of the system. And any increase in differential tuition by one of the doctoral granting institutions would also have to be made up by additional scholarship dollars to prevent students from not being able to access the university centers, for example. So it's not by specific program, but it's based upon the institutional master plan on file with SUNY. If they're a doctoral campus, they would be one of the ones that are eligible. The 4 university centers are on board with this. The statutory colleges at Cornell, as well as Oxford University, have been lobbying for this as well.
Thank you, RJ. And again, that's the benefit of having a professional staff member on the SUNY-wide Faculty Senate for the plenary. So thank you very much. Also from a recent Faculty Senate meeting, Dr. Weber in his Provost's report mentioned that capital planning is looking at some of the, I hate to say it, hot spots, but spots on campus that are suicide or self-harm locations or risk locations on campus. One of those is the stairwell in Clemens Hall. That is a priority. Right now, they've put an elaborate flag system up in that staircase to kind of a temporary fix, but it's very much a longer range fix is in the capital plans for the University of Buffalo. So thank you for those members who brought that to our attention. I did represent the PSS at a campus governance leaders meeting yesterday. We meet to exchange different points of information that might be important to one group or to even a union, yet good to know for the other organizations. Yesterday, the UUP chapters of the Health Sciences and the Buffalo Center chapter presented a draft letter to all of the campus governance organizations, and they're basically asking all of us to sign off on that. The letter was a request of UB administration to consider forming a health and safety committee on our campus to get input from all the various groups, student groups included, on future health and safety issues at UB. I did add my name to the letter as it was a request to consider, a request to the president to consider including all the various groups, PSS, Faculty Senate, student governments, and both UUP branches. This is to consider forming a health and safety issues committee on how decisions are made that might impact students, or even looking at union contractual items as it relates to health and safety issues. So the idea was to make an inclusive process that we're already a part of even more inclusive by welcoming in the various bargaining units on campus. I will keep the membership updated on this issue as we go forward. If you are on campus this spring in person, you must fill out the daily smartphone or online form about your personal health. You must go once a week for testing. We're testing everybody who comes on campus on a weekly basis. I was notified that somebody, one of our high-ranking officials, was in one of the pods or pools that had a positive test. So that person was called. They had to leave campus right away and begin quarantine. 24 hours later, they retested their sample, their individual sample, and they were told that they were all clear. So we are following this very closely, even at the highest levels on campus, and adhering to keeping everyone safe. Last, the Faculty Senate is announcing that they have 3 openings for the statewide senator positions at the statewide level, faculty senators. Of the 4 statewide seats for UB, RJ Maltari has been the lone professional. He just chimed in. Thank you, RJ. If you have questions on what being a statewide senator involves, please reach out to either RJ or myself. The UB Faculty Senate runs this election, but UB faculty and professional staff can run and vote on these openings. In fact, the UB Faculty Senate just sent a call for nominations out yesterday. and I was told that there was an error in it. They need to tweak that announcement, as the rules are a bit more restrictive for where the faculty nominees can come from. They are not as restrictive for where the professional nominees are going to come from. So look for an updated email from the UB Faculty Senate soon, I hope, on that call for nominations, so that any of you can run for a UB or a SUNY-wide Faculty Senate position. And then lastly, I was informed yesterday that the Blackboard contract is expiring with SUNY, and it will not be renewed. So look for an announcement on a very similar product, a different vendor, to be provided very soon. And that concludes my chair's report. I would take any questions, or in the interest of time, I would take a motion to accept my report.
I can motion.
Motion.
Okay, that
Who's that?
Kim.
I'll second.
And the second was Janice. All those in favor, please say aye.
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 Any opposition? Thank you. Vice Chair's report.
First of all, I want to just thank Kara Kane from the county, who stuck around after Gale's departure to answer the individual questions that we could not get to. That is a lot of class. That's something that we may want to adopt, Mr. Chairman, in future for this kind of a format. Okay, let's go around the PSS in 90 seconds here, because we have other business to get to. So awards committee, awards nomination deadlines are coming up on March the 11th. For the outstanding service and outstanding service to the PSS awards. We're going to talk about Constitution and Bylaws business a little further down the agenda. Election committee, officer elections for 7/21 to 6/23 are underway. I believe they end tomorrow. Inclusion and diversity committee, as Tim pointed out, we've had a change in leadership. Jessica Coram has been approved by the executive committee to take the chair of that committee. And also that committee has put forth and has had approval on their new charge. Please go to their website and take a look. I think the charge is already up. Marketing and communications, considerations being given to a new free email marketing tool. The committee may use one of the products to send out the next newsletter. February newsletter was mailed to 2,772 recipients and had a 804 person viewing, which is fantastic. That's a great open rate of 29%. And the Sustainable Living Committee met on the 15th at noon. Committee has a new member, Jennifer Chazen, who's the director of the Office of Student Services in the Graduate School. We discussed potential virtual presentations from past Living Fair attendees, as well as the restart of the tree inventory project that Tim already talked about. We were also subsequently asked by UB Sustainability to assist in getting the word out about a new carbon offset project with an internet platform called UCapture. We'll be sending out information about that later, but basically it's very cool. It allows any employee on campus to sign up, put an extension on their search engine, and also choose a project somewhere in the world that is offsetting carbon, like tree planting or buying safe stoves for people who are in third world countries, so that they're not killing themselves with carbon monoxide in their own home. A very cool opportunity, but it also allows us to offset the carbon on our campus from the activities that we undertake, either as faculty, staff, or students. That, Mr. Chairman, is my report in 90 seconds.
Thank you very much. Any questions for the Vice Chair? Hearing none, I'd entertain a motion to accept his report.
I'll motion.
Identify.
Janice
Janice?
Jankowski. Yep.
Thank you. And a second?
Kathy Donnelly, I'll second.
Thank you, Kathy. All those in favor, please say aye.
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 Any opposition? Thank you. Secretary's report, Hugh Jarvis.
Nothing to report. Thanks.
Thank you, Hugh. All right, moving on to some unfinished business. Let me set the stage for everybody here for what's about a year and a half ago now, it's almost 2 years ago, President Tripathi based his State of the Union address on his goal and the campus's goal to move to a top 25 ranking in national college and university ranking systems. With that said, we've been working since that time, and obviously interrupted quite a bit when we had to go remote. We've been working on a resolution from the Professional Staff Senate to present to the President and the UB Council, stating that we not only support the drive to 25, but ways in which we the professional staff feel we will be integral and important and very much the catalyst in moving UB towards that. The following resolution that I'm going to show you has been voted on and approved by the executive committee. Today, I would like to show it to the general membership. And if we, at the end of this, if we would like to move this forward and accept this resolution, I would be happy to present it to the president of the university and ask him to give it to the UB Council. And I would do that on Shared Governance Day, which occurs the first Tuesday in March, which is coming up next week. And we'll talk a little bit about Shared Governance Day in just a few seconds as well. So I'm going to show you the screen and let you take it all in, and then we can have a conversation at the end. So this slide concludes the resolution. Basically, we've been reaching out and re-reaching out throughout the past, 12, 13 months, asking for everyone to make sure, they're represented in some small way so that we can always refer back to this document and say, remember when we submitted that document on March 2nd of 2021, and we talked about, remote work. Let's open that up and look at that. There's veterans in there. There's 4- and 6-year graduation rates. There's pretty much every office that we touch on campus was somehow loosely mentioned in this proclamation, so that we can refer back to it with the president and the administration and say, we're open to the challenges, but we need to work with you to advance that particular area of campus that we're experts in some factor, towards a top 25 ranking. So with that said, are there any comments, conversation? If not, I would accept a motion to call this to a vote of the general membership. Again, this has passed the executive committee. We're looking for a vote of the general membership now.
Tim, it's RJ. I submitted a motion to accept.
Thank you, RJ. A second?
Augustine, Jen.
Thank you. We have a second. Any discussion? If not, we will call the vote, and we're going to try something different. I hope this isn't controversial, and if it is, we can redo this. But we're going to post a poll on the screen, I hope, and we're going to allow only PSS senators to vote. So the general membership is a part of this, but your elected senator will be voting on this proclamation. Great. I think we can end the vote at this time. It looks like it passes unanimously with 26 votes, 12 abstentions from the group that's here today. So thank you all very much for that. Next item of business, we move on to Don, Herb, and the bylaw changes. Don, do you want me to stop sharing my screen so you can share yours?
Please. Still not there.
Trying to make you a co-host. There you are. Now you're a co-host, Don. You should be able to share.
Okay, can we see that?
Yes, we can.
Okay, so I'm gonna bring two things to your attention. So the proposed amendments to the bylaws and to the standing orders have been sent out 2 times to the general membership. In addition to those 2 mailings, 2 Zoom virtual get-togethers were put on by the committee to discuss changes to the bylaws and to the standing orders. After the virtual events, though, we found 2 small things that needed to go back to the executive committee for their approval. Very slight, but I want to bring those to your attention. So let me get rid of this. It's funny, I can't even. There we go. Okay. So under Article 16, the ratification of amendment of the standing rules, item number, or Section C, item 1, there we were quite certain that the word Senate was missing from that sentence, because otherwise it would have taken a majority vote by the entire membership to pass an amendment. So we went back to the committee who created the original set of standing rules and asked the question, what did you mean? And they said it was meant to be Senate. So that word was inserted and approved by the executive committee. The second change that we made was in regard to item number 4, which we wanted to make sure that the bylaws and the standing orders were aligned with each other in terms of our notification requirements before meetings. The executive committee, though, felt that they wanted to change the word from secretary as to the 20-day business mailing to the secretary to the chair. The reason being that the chair is the person who sets the agenda for meetings, not the secretary. The secretary makes sure that they're sent to the members, but they do not create the agenda. So with those 2 slight changes, we would like to keep this process moving. So unless there's, great angst with this group, Mr. Chairman, what we'd like to do is take it to the next step. And the next step for this ratification process, or amendment process, I should say, is to send the acceptance or not accepting the bylaw changes and the standing order changes out to the membership via our voting platform. So I will leave that with you, Mr. Chairman, and that's where we are currently.
Very good. Does anyone have any comments on this? If not, I can move the item along at this point. So any comments on this from the group? Hearing none, I will recommend then that the committee take this to the elections committee for their assistance in sending out the vote to the membership. And we can hopefully, have a call to get these ratified by the membership and then make them as such. So thank you very much, Don, for that work.
All right, I'm going to stop sharing my screen at this point.
Please do, and I'll see if I can pull mine back up. Are you able to see my screen?
Yes, sir.
Great, thank you. New business, as Don mentioned earlier, a new chair for the Inclusion and Diversity Committee. So Jessica Quorum, thank you very much for that role. We look forward to some great work from you and the committee this year. Also, Don, if you'd like to go through the changes to the committee charge.
So this is the old charge, and it was expressed before as a mission and a committee charge. If you would show me the next screen, Mr. Chair. This is the way we have hoped to express our charges going forward. And the reason that we're shortening them is because we want prospective members to, and members that have an interest in being involved to be able to quickly go to each page of the website and to look through the charge quickly. You can also have information behind your charge and connected by various buttons and so on and so forth, or learn more kinds of things as a committee. This particular committee has not done that, but this is the format that we wish to follow going forward for all of our committees, so that we can get more people involved, so that they understand the crux of what each committee does.
Great. So for formality's sake, this has been passed by the executive committee. We would like to put it before our senators again in a vote. So if you are a PSS senator, please vote on the following poll. Jessica, if you want to pull that up. Approval of new charges recommended by the Inclusion and Diversity Committee. All those in favor versus noes and abstentions. And it looks like that has passed unanimously as well. 25 yes votes, no negative votes, and 6 abstentions. So thank you very much for your vote on that. All right, just a few more items. Thank you for staying with us this long. We'll be done very quickly here. The awards celebration working group. So I am calling out, let's see, I had a nice little talk here. Yes. Who likes parties? What if I told you that the PSS is willing to give some folks a small budget and allow them to plan a party? Sounds pretty good, right? Well, we already have one volunteer in place, and I need a few more people who will help plan the PSS Awards Recognition Reception. The idea is a champagne toast with some light hors d'oeuvres to celebrate the 2020 and 2021 Professional Staff Chancellor Award winners. Rebecca Brearley from Pharmacy, a PSS member, has already volunteered to help with the organization, and she's looking for some more members to help her. She has many great ideas for a fun and tasteful event I mentioned before with champagne. So if you are a party planner at heart, using someone else's money to help pull it off, please email me at tat@buffalo.edu to join the effort for a working group on planning a celebration for our Chancellor Award winners from the PSS when we can all be together again. Next, I have the Retirees Committee. A vision of mine has always been to form a Retirees Committee of the PSS. I already have 2 members that are interested in working on this, and I'm looking for a few more. If and when we're all lucky enough to retire from UB, many have expressed that they might like to stay minimally involved, maybe help read scholarship applications, help on campus tours, lead lunchtime nature walks or yoga classes. Really, the sky is the limit. And I'm sure there are many student-centered opportunities out there as well. If we organize a PSS Retirees Committee now and think of ways to advertise and offer the volunteer services of our retired members, we will then be best situated to offer retirees some active roles at UB and be a very useful resource for UB offices. You know, those people still having to work. So if you want to help think this through as to what a PSS Retirees Committee might look like, please again, reach out to me at tat@buffalo.edu, and we will get all those interested together and see what this might begin to look like. So thank you. I think that's 2 sort of fun committees or groups, a light lift that you could have some fun volunteering for. Lastly, Shared Governance Day. We do have a resolution on our books that the 2nd Tuesday of every month, we celebrate Shared Governance Day. We celebrate the idea that, just this past year, we've been brought into the conversations as far as the COVID planning and things of that nature. We've been asked to serve on many search committees and have professional staff represented on search committees across various high-ranking, high-level hires across campus. It has been working well only because of the diligence of those who have come before us. So since we can't be together this year to celebrate Shared Governance Day, we are dedicating the March 2nd newsletter to shared governance. I've had some comments back from President Tripathi and other leaders on campus that they've spoken about the value of working together under the shared governance umbrella, and also where we still need to get. It's never going to be perfect, and we have to keep working on this, every time we meet with each other, the various groups on campus. But we want to celebrate all we've achieved so far. So look for the March newsletter to be a heavy reference towards Shared Governance Day. And also now, since we passed the Drive to 25 resolution, I will fold that into the newsletter and make every effort to present that to the president and the UB Council on Shared Governance Day, which I think has some really great symbolism. Upcoming meetings are our next March meeting, March 25th, the general membership. We have invited and received confirmation that Vice President Laura Hubbard, the VP of University Finance and Budget, will join us. She should have a much clearer budget picture for us at that time. And then in April, if you want to mark your calendars, April 22nd will be UB President Satish Tripathi to address the members of the Professional Staff Senate. Anything for the good of the order? Hearing none, thank you very much. Meeting adjourned.
Thank you. Officers, please stay on.
Thank you.
Bye, everyone.
Bye, everybody.
Thank you. Thank